watching HealthDNA. I'm Anshu J. Singh. Today we have with us Dr. Sanjeev Gulati. He's Executive Director, Nephrology and Kidney Transplant, Fortis Escorts, and he's going to talk to us on this World Kidney Day. Welcome, sir.
Thank you.
So what are the early signs of a kidney disease?
Well, first and foremost, I'd like to tell you that chronic kidney disease is a silent killer. And most patients have symptoms coming very late during the course of the disease. But if you were to look for early signs, then things like froth in the urine, blood in the urine, passing more frequent urine at night especially, could be some of the symptoms of kidney disease. If you have high blood pressure, then it could be a sign of underlying kidney disease. Swelling all over the body, low hemoglobin, and especially in children, if they're not growing well, then these could be some of the signs of chronic kidney disease.
So what are the risk factors and how can we avoid?
So if you look into the top 3 causes of kidney disease, diabetes and hypertension stand very prominently. And as you can see, both of these are lifestyle diseases. To a certain extent, it's preventable. So if you, first and foremost, you should have a healthy lifestyle so that you don't develop diabetes or high blood pressure. And if you do have diabetes or high blood pressure, then you should control these very meticulously. Thereby, you can protect yourself not only from kidney disease, but also from a lot of other diseases.
What are the tests that we should go for?
Simple tests. First and foremost is a urine test looking at protein excretion. We call it an albumin-creatinine ratio. Earlier on, we used to make you do 24 hours urine collection, which is very difficult to do. So a first morning urine specimen should be done. You look at urine albumin-creatinine ratio. Second is do a blood test, kidney function test. But in that same vein, I would like to tell you that please do an estimated GFR. A lot of laboratories are reporting eGFR now. eGFR is percentage kidney function, and it is abnormal much before the serum creatinine, which some of us know about it. And third is an ultrasound.
So don't you think lack of attention is given to kidneys when we talk about our body organs?
That's very true, and this is one reason that globally chronic kidney disease is increasing. The earliest prevalence estimates were close to about 5 to 10%, then they became 10 to 15%. And in a recent study conducted by the Indian Society of Nephrology, when I was the president of the society, we did a nationwide study screening close to 2 lakh individuals, and we found a very alarming incidence, about 20 to 30% prevalence of chronic kidney disease. Another reason is that, kidney disease is silent. Unlike heart, you don't have a heart attack.
Yes.
That's why it's increasing world over. And research shows that in times to come, it's going to be the 5th leading cause of death all over the world.
So how often should people must go for screening?
Well, first and foremost, the screening should be done in high-risk individuals. So what are these? Anybody who's got diabetes, anybody who's got high blood pressure, then if you have family history of kidney disease, if your age is more than 40 years, and if you are overweight, then this segment of population should go in for an yearly health checkup and screen themselves for other diseases, including kidney diseases.
So how can we maintain good kidney health through diet or exercises?
So yes, what I always tell my patients is that, your kidneys are like your diamonds. Once damaged, they cannot be repaired. So protect yourself from kidney disease, at least for their family members, I tell them. And how do you do that? You follow the 7 golden rules. Monitor your blood sugars periodically, and if you have high blood sugars, make sure they are under very good control. Check your blood pressure regularly, and if your blood pressures are high, make sure that your blood pressures get down to normal, which is 120/80, nothing less. Third, avoid smoking. Smoking is associated with heart disease, lung disease, but smoking also causes kidney disease. In fact, it's one of the purest poisons as far as kidney disease is concerned. Number 4, avoid over-the-counter self-medication. You're going to your chemist asking for treatment from a person who may not even, have passed his high school. How can you entrust your health in his hands? So, intake of painkillers, number 1, anti-acidity drugs, and our experience has shown even alternative therapies of medicine which are unscientific, unvalidated and untested hugely prevalent on the social media. People are going even for things like constipation, they are taking alternative medications and they are coming to us, with all these problems. Next is have a healthy diet, which you mentioned earlier. What is a healthy diet? A diet which is low in salt. So Indians are the most voracious salt eaters on the entire planet. So I think we should avoid the achar, chutney, papad, raita, these kind of avoidable sources of salt. And in the same vein, a lot of fast foods, life has become busier and we don't have time to cook for ourselves. So we are relying on fast foods. Take a diet which is rich in fresh fruits, salads, low-fat dairy products, nuts. It's a holistic. You will not only protect yourself from kidney disease, but a lot of other diseases. Do regular exercise. Most important. My point number 6 is exercise, or in the same vein, I would say yoga, because yoga, in addition, has an advantage over exercise. It reduces mental stress also. And this is something which has come from India, but it has been scientifically validated from studies from leading medical schools in US, that yoga reduces blood pressure, reduces sugar, as I said, 2 of the commonest causes of kidney disease. So at least half an hour daily of yoga or gymming. And last but not the least, we mentioned earlier, an annual health checkup. Invest in your earnings in a health checkup, because prevention is better than cure, and in this way we can diagnose kidney disease early.
So who are supposed to go for kidney transplant? Who is it recommended for?
So, kidney transplant is the gold standard for stage 5 chronic kidney disease. Whatever you might find on social media, including TV channels, there are TV channels having stop kidney dialysis and all kinds of alternative therapies. But let me tell you, that is absolutely unscientific, it's unvalidated, and the current US is currently spending $100 billion for management of stage 5 chronic kidney disease. If there was any treatment that was there in India, I'm sure, it would have been first taken up by US, because everybody wants to spend less money on healthcare. So unless and until these treatments are tested by scientifically validated methods, there may be alternative systems, but the scientific methodology doesn't change. So scientific methodology is a randomized controlled trial. So once these therapies have passed that acid test, then surely they can be used. But till that time, kidney transplant remains the gold standard. It has the ability to transform life of a chronic kidney disease patient, from a patient who's dependent on his family members to a person who's become a useful member of the society, who's able to earn for himself, support his own medication, as well as support his family members. And we have several patients like these in our follow-up whose lives have changed after kidney transplant. It's absolutely a successful form of therapy with an immediate success rate of 99%, 1 year success rates of 95%, and 5-year survivals of 80%.
So what about those who already have kidney issues? What are the things that they need to take care of?
First and foremost is, regularity with your medications. Most of these patients invariably have high blood pressure, so make sure your blood pressure is under good control, because by slowing blood pressure, by controlling of blood pressures, we can slow down the progression of kidney disease. Second is that we also monitor these patients very closely. So go to your doctor, get your test done. We look for urine protein leakage. So if they have urine protein leakage, we give them certain medications which are now become available in our country, whereby we can reduce the protein leakage. And yes, if they have diabetes, it goes without saying that your diabetes should be under good control. Don't take painkillers, because a single dose of a painkiller can knock your kidney function by half. Take a healthy diet. Be careful of what you take and what you do not take, but don't restrict protein overtly, because then you become too weak and you get prone to infections. Take vaccinations, because infections cause worsening of kidney function, your immunity becomes weak, so you are more prone to infections. So regular vaccinations are a must in these patients.
So talking about women's health, don't you think women today in their 30s are having kidney issues? And my another question is, do you think it affects women more than men, kidney issues?
Well, you're right, partly. There are certain diseases like urinary tract infections, it's an immunological disease called systemic lupus erythematosus, which preferentially affects women. And the same in some kidney stones also, some studies have found they are more common in women. I think all over, whether it's men or women, we are seeing kidney disease early. And high blood pressure, I think, is the stress of modern lifestyle, the diet factors that we discussed are all contributing to it. And women also, I have found, do neglect their health, as compared to men. Men also don't come for regular checkups, but women would not be getting, even a higher proportion of women are not getting annual health checkups, which is the only way to diagnose kidney disease early.
So, if I talk about kidney health, how crucial it is, the role of kidney health, how crucial it is when we talk about our overall health?
So, kidneys are organs which remove the toxins that are generated in the body once you eat your normal food. They get rid of the excess water. They are very important for your bone health. They are very important for maintaining a normal hemoglobin. And if you have kidney disease, these toxins start building up and they affect all your other organs which are healthy. And as I said earlier, kidney disease is silent, so often picked up very late. So in that sense, kidney disease has got a propensity to damage all the other organs, which is why kidney disease should be taken seriously and should be treated at the earliest.
So what would be your message on World Kidney Day?
So on World Kidney Day 2024, the message for this year is kidney health for all, and especially for the weaker sections of the society who often end up neglecting their kidney health. And I would also request the Government of India to launch a nationwide kidney disease screening program because prevention is better than cure.
Thank you so much, sir, for giving us your time. It was a pleasure talking to you.
Same here.
Thank you.
Thank you.